Alright, the next video we're going to be doing is the instructional video for the shoulder x-ray exam. For this exam, we're going to be doing 4 different projections that you guys will all be doing for your practical. That's AP internal, AP external, Gracie, and Y, or scapular view. So we're going to move through all 4 here in your instructional video. Mrs. Skaggs is going to be my patient. And for this exam, you're going to be needing to do all of your projections on a 10 by 12 IR. We're going to be putting this in the bucky for these, and we're going to be doing it crosswise. So when you put this in the bucky, so far you guys have been using 14 by 17s, where you can just put it in here and lock it in. But for this one, as you can see, we're all the way down at the bottom. We need to be right in the middle where we'll get a good exposure. So in order to make sure we're in there correctly, we're going to use this adjuster, and to release it, you just slide this thing that looks like a button over, and it will come out. And then you're going to adjust the height of where you want your image receptor to sit. So since we are doing our exam crosswise, we're going to put this at the level of the 10, which is for a 10 by 12. I'm going to go to where it says 10. There's 2 slots there. I'm going to stick these 2 little pieces in the slots and then let it rest down. So it just goes in and then it rests down. And then I can put my image receptor in here right on that little ledge. Now it's right in the center. And then I can slide my handle over to secure it right in the middle and snap that down to hold it in place. That's how we're going to make sure we're in the right position. Now once I have this 10 by 12 into the bucky tray here in the wall at the upright unit, that is where it's going to stay. We're going to do all our projections on that size, so we're not going to mess with it again. We can go ahead and put that inside. Now for shoulder, we're again going to be using the lap shield, not the full shield, because that would block our view. Again, we're going to make sure that this is on where it's actually doing her some good. So if we put it on like this, that's way too low. We're not protecting anything we want to be protecting. And we're looking up way up here at the shoulder, so we want to make sure that we have everything protected. This shield's not going to be in our way, so we want to make sure it's nice and high on her waist. Now I can already tell that she's got a necklace on that's going to have to come off. But also for this exam, you're going to want to make sure that your patient isn't wearing a bra that has those adjuster straps, which will show up, or anything that's going to be in that shoulder area where you're looking. So you want to make sure you check for that. So we're going to demonstrate on Mrs. Skaggs' left shoulder so that you guys can see everything. I'm going to start by just turning on my light. We're still here at 40 inches, which is where we just were for the humerus. We're doing these together. So we'll stay at 40 inches. I'm going to raise this up, and we're going to start with the AP internal view. So where I'm centering here is I'm going to kind of look at the top of her shoulder, and your book talks about going down an inch and centering there right over the shoulder area. I'm also looking at the edge of her arm and also towards her sternum, and I'm going to kind of center between those 2 areas as well. Let me hit the light so you guys can see a little bit better. Alright, so I'm going to scoot her over a little bit, just so that I'm right in the middle between those 2 areas. And then I've got light up here, but not an excessive amount back here on my upright unit. So that looks pretty good to me. So I'm going to grab my marker and mark the outside lateral. Again, I'm using my left marker here because I'm doing her left shoulder. We're always going to mark the side that we're doing. Right there in the light. So we're doing internal first. So what I'm going to have her do is turn her arm in, and I'm actually probably going to just bend her elbow too, so that way she can keep it nice and steady, resting that hand on her hip, and I can make sure that she's turned in well. The thing you don't want to do is when you have your patient turn their arm in, is have them roll their shoulder forward as they're really trying to help you. You want to make sure that you keep their body back so that it's parallel and up against the IR, so you'll get a good image that's not distorted. Otherwise, your arm will be so far forward that you will kind of distort your image and also superimpose some of your structures. So you want to keep it right like that. And We are using 85 kVp for this projection. And for these, again, since we are looking in this area where she's breathing, I'm gonna have to have her suspend respirations. Oh, I forgot to do something. Let me check and make sure. Yep, my Bucky's way too low, so I'm gonna have to raise this up. Which means I'm gonna have to fix my marker. Which means I gotta make sure I still have her in the right position. She looks good. And all we're doing for this is just suspending respiration. So I would give her breathing instructions, something along the lines of, please hold your breath, expose, breathe. All right, so that's internal. Now, we're gonna do external. So I want you guys to leave everything where it is, because all external is simply manipulating this arm. So this arm, now I'm gonna have her turn her hand all the way out. So now the palm of her hand is either facing straight out or actually towards the right. So long as they can rotate their arm, ideally we would turn it out the best that we can. If they can only turn it so that their palm is facing forward, that's fine too. What we really don't want to do, again, is really have them trying to turn it out and they're leaning their whole body that direction. We want to keep their body nice and straight. So this is all we have to do to turn our internal projection to an external projection. Again, I would just have her suspend respiration for me, hold your breath, and then we would expose at 85, and then she could breathe. So those are the first two. Now the next one is gray sheet. And for gray sheet, we're gonna be angling our patient. We have set everything so well here that we're not really gonna be manipulating our Bucky up or down or our tube up or down. We're at a good height. But we're going to be moving our patient. So for gray sheet, I am going to be angling her body. I'm going to be angling her body 35 or 45 degrees. So I'm going to turn her that way. Again, this is a time where you guys can use your elbow if that helps you, and kind of lean them up against your elbow and make sure you kind of got them at 45. Now for this one, I think it's pretty, you guys can kind of see. I'm looking to center right over her scapulohumeral joint, which is just right at the very edge there. It's almost where you can feel the edge of your clavicle. You can kind of see that that's right where the joint's happening. So I'm going to scoot her back a little bit so that we're focused on that area specifically. And then honestly, I can cone in a lot more because I'm just looking at that humeral head. That's the focus of this projection. So I'm going to come in here and I'm going to collimate, which Mrs. Skaggs is going to love because she loves collimation. And so I'll have to move my marker in to make sure it's still in the light, it's still in the exposure field. Now your book talks about the positioning of their arm being across. That's perfectly acceptable, and we'll be able to see the joint space there. I know when I do this in clinic, I usually turn their arm out. That just makes sure that that joint is open for me as well. So either way that you want to position their arm is fine, but don't just leave their arm hanging by their side. You want to make sure that somehow you're kind of supporting the fact that you're trying to get that joint to be open, either this way or that way. And that's gray sheet. The final thing we're going to do is the scapular Y, and in this situation, we're actually going to turn the patient PA. Get my marker. Okay. So now that we've got her PA, we're still looking at the left shoulder, but now the left shoulder is on this side of her, closer to me, so don't let that fool you. And in this time, we are going to be angling her, and this is a little bit more of a steeper angle. It's going to be a 45 to a 60 degree angle, and that's going to be, in this circumstance, an LAL. So we're going to turn her very, very steep here, very, very steep. This is not a lateral though. I don't want her all the way this direction. I just want her at an angle. What we're trying to do here is get that flat side of her scapula perpendicular with our IR. So some people, you have to turn them a little bit more. That's why your book gives that range of 45 to 60. Now to really be able to feel this scapula here, I want to find that scapular edge. And like we talked about before, you might have to have them move their arm forward and backward to feel it. On Miss Skaggs, it's very easy to feel, but you might run into a situation where you kind of have to work with it. So I can feel it. I can feel that this is the flat area of her scapula, and I'm going to try to kind of turn her until I see that happening with it being perpendicular. Now, since we collimated for that gray sheet, I'm cropping off some things here, so I'm going to have to adjust my collimation to be a little bit taller. There we go. Now, our centering point is going to be right over this medial aspect of the scapula. So I'm going to scoot her forward a little bit until I can see my centering point right there at the medial aspect where I'm looking. Now, your book doesn't really talk about how to put the arm in this situation. In fact, I think it's kind of leaving it down. But in true clinic, you're really going to want their arm out of the way so that their humerus is not in this picture. So I'm going to have her, yes, bring her arm out in front of her across her belly as best she can. So if they can really reach around, that would be best because it'll pull their scapula further out away from that humerus. And when we do this, I'm just going to have to double check and make sure I got you in a really nice position here. And I will grab my marker. I'm going to make sure you got right over that medial portion. And we're going to leave our technique at 85 kbp. I'm going to ask her to hold her breath and expose. And that is scapular Y. And those are your 4 projections that you'll be doing for shoulder.